A surge in diabetes cases among Indigenous groups has prompted our state's researchers to take action. They've marked World Diabetes Day with the largest study of its kind, aimed at beating the potentially deadly disease.
A growing problem communities are desperate to stamp out.
I've grown up seeing my great-grandmother, my mum, my grandmother, a lot of my family, go through diabetes.
1 in 3 Indigenous people will develop type 2 diabetes, a rate much higher than other Australians. Complications from the chronic condition, such as kidney and heart disease, is a leading cause of death among this group.
It's really, heartbreaking. Really heartbreaking to see.
The South Australian Health and Medical Research Institute is trying to find some answers. They're asking 4,000 Indigenous people, half living with type 2 diabetes, to take part in a study looking at why disease rates are rising, especially in children and adolescents.
This is a once-in-a-lifetime sort of study. It's a landmark piece of work and South Australia will lead the way.
Diet, environmental and genetic factors will all be considered, as the group, run largely by Indigenous members, gives each participant a thorough medical check. Participants in the study can initially come here to be tested before researchers begin travelling to communities across the state, starting with Murray Bridge next year. Up to 20 areas will be covered over the next 5 years. Aboriginal elders support the project.
We can take control of it. It doesn't have to control us.
We're going to follow these people for a long period of time and hopefully deliver better care, better services and identify the targets for preventing diabetes into the future.
Tom Angley, 9 News.